Whelan Presley Funeral Home and Crematory, a proud supporter of WQPT, has been serving Quad City families since 1889. Now providing live stream capabilities for viewing your loved one's funeral or memorial service at their chapel in Rock Island.
Increasing concerns with increasing COVID cases. Is there a real possibility we'll see new restrictions to protect our health in the cities? Students back in school and people enjoying themselves at crowded venues. These are the two focal points for public health leaders who say they're seeing steady increases in the number of COVID-19 cases seen throughout Illinois and Iowa. Add to that the upcoming seasonal flu months, and it could spell trouble for our health and the added cases that might be seen at area clinics and hospitals. People who thought the summer could kill off the coronavirus were wrong, and now a winter of mixed illnesses is not a pleasant thought at all. We sat down with Rock Island County Health Department Chief Operating Officer Janet Hill, one of the public health workers on the front lines of mitigating this pandemic. Janet, let me start with that. What are the chances we're seeing restrictions in other areas, like we said, the St. Louis area in Illinois and south of Chicago, that we're seeing new restrictions put in place because of rising case numbers? What is the chances that's going to happen in our area as well?
We're seeing rising positivity rates all across the state. So far, the mitigation efforts haven't come to our region, which is Region 2. However, on Friday, the state announced that 30 counties have gone into warning status. Rock Island County was not one of them. We have been bracing for that for about 3 weeks, but we have been hovering just below the threshold to move into warning status.
You don't sound all that optimistic that it's not inevitable.
We are seeing a lot of people who are testing positive, and the numbers are trending lower. So we are seeing people who are just getting sick of this and are not taking the precautions that they did at the beginning. And the virus isn't going anywhere anytime soon. And we are all sick of it, but it is just something we're going to have to live with for quite a long time.
So what do you attribute this to? I mean, let's talk about a couple different sectors. I mean, schools have just opened in many areas. Classrooms are now being utilized that haven't been utilized since last spring. Is that one of the factors that you're seeing as far as higher test numbers? Is that perhaps more students are attending school and perhaps bringing it back home, or are getting sick themselves at school?
We have been seeing children throughout the pandemic test positive, but I would not say that right now that is a driving force for our increasing numbers. We are seeing some teenagers, but we're seeing people mostly in their 20s and 30s. That's the average age right now. Yesterday, our average age was about 35, and so we don't see that schools at this moment are driving the increasing cases, but we certainly anticipate that could be a problem down the road.
So when you're saying 20s and 30s, that makes you not necessarily point to schools, but perhaps restaurants, bars, taverns, and parties and gatherings.
Right. We are seeing a lot of community-based testing or community-based outbreaks, at parties and at family gatherings. The weather is still very nice, and people want to get out and do things, but the behaviors that they're doing are causing them to get sick. And I think that, younger people they're not afraid of it, and they really should be, because you do not know how your body is going to react to it until you get it. And then if that's not scary enough, you don't know how you're going to impact other people. So this really is a kind, community-hearted thinking that you must have. I mean, how horrible would someone feel if they got their grandma sick, or they got their dad who had recently recovered from a heart attack sick? It isn't just about the individual person. We really have to think broader.
We have been talking about the schools, the youngest of children, as well as into the middle and the high schools that are reopening. A lot of them are doing it in coordination with county health departments all throughout our area. Are you pretty confident that the schools are doing the best they possibly can, although infections are probably inevitable?
the schools have worked very hard to get their kids back into the classroom. And we heard this week from a mental health expert saying that, children really should be in the classroom for overall mental health well-being. And we know that the school districts have had to make some really hard decisions about how they're going to get kids into the classroom, whether it's a hybrid or full-time. And we've been working very closely with school leadership to help them fine-tune their plans to make it as safe as possible. That said, this virus is very sneaky, and it's going to get people sick if they are not following, the 3 W's of watching your distance, washing your hands, and wearing a mask.
Very sneaky, but also really unpredictable. And we have heard from the White House and from others as well, is that children seem to be able to handle the virus better. Younger children, I know that there are cases where young children have gotten very sick, if not sadly have died, but for the most part they seem to weather it better than older adults. Is that true, or is that more of an urban legend right now?
No, it seems to be true, and that has been since the very early data coming from China. There was that time where we were hearing more about this multi-inflammatory disorder that kids were getting. But it seems to be that kids are a little bit easier to shake it off than older people or even middle-aged people. However, we do know that the children are asymptomatic transmitters of the virus. And so that's why even kids need to take the precautions that we've all been talking about.
And you point that out, of course, because asymptomatic means a child could be running around but could easily spread it to an adult who might really be infected and be in trouble.
That's absolutely true, yes.
Does that make you a little concerned when you come to the fact that more children will be in school and then you might have a Thanksgiving break, or you go visit grandma, or even as parents that you somehow become more exposed to your own children, believe it or not?
Right. Well, anytime that there is a gathering, whether it's in school or a party or any other, restaurant that's too close together, there is risk. And, we do worry about more kids coming down. We do worry about the impact that it's going to have just throughout our community. More people in smaller spaces is going to mean more infection.
New restrictions, as we said, in other parts of the state of both Iowa and Illinois. Is it something that, I don't know, is it a way to mitigate what's going on, or will it really even put that big of a dent? I mean, you almost have this feeling we've been going through this so long. I know you, as well as everyone else, is a little COVID weary at this point. And as you said, it's like, oh, you know what? I haven't gotten it yet. I'm just going to go out and do whatever. I mean, so will these mitigating factors, will these new restrictions even really have an impact?
I think it will. First of all, the restaurants have to close at 11 o'clock. Bar stools have been removed. There's no waiting allowed, before your table is ready. There's no gathering at a bar. So these efforts really do go to trying to make it so people are not too close together. The governor has set up 3 tiers. So these are the first of what could be 3 tiers. And at tier 3, that looks very much like we were like in phase 3, which is a lot more of a lockdown status. So I think that, the idea is that you let people know behavior does not change. We absolutely could go back to what it was like in March, April, and May.
Let's talk about some of the mitigating factors that have actually been put in place elsewhere. When this pandemic first really broke out back in, let's say, March and April, early May, it was meatpacking plants and some of the larger industries that were really hit hard right off the bat. We don't hear about many cases in those plants anymore. So is what was done back then working now?
The Tyson plant, we are in constant contact with them, the one in Joslin. We talk to them every day, and their infections have absolutely flatlined. They have done an amazing job of controlling the infection in their plant. They use plastic partitions. They enforce strict social distancing. They have hand sanitizing stations, and they monitor temperatures. They do pre-employment screening before any. So anyone who is going to work there is tested before they are allowed on the premises. So all of those efforts are what we should look to as a model. And in fact, Tyson is using its Joslin plant as a model for the rest of the country.
And let's take it the other step, too, is that Rock Island County saw a spike once because of the East Moline Corrections Center, where there are a number of cases there. We don't hear much going on at the prison either. I mean, are there mitigating factors in that, or is it that the prison decided that that what it is doing is working?
You know, it just goes back to the 3 W's. The prison is taking efforts to make sure that that they can control the infections. One of the main reasons there was an outbreak at the prison is that guards were coming in and going every day, and they were bringing the infection into the facility. Obviously, the prisoners are not the ones going out and getting it. So I think that just general understanding of how infection prevention measures are working at meatpacking plants and at prisons, and to a lesser degree of success at long-term care facilities just show that once we do the efforts, we can see positive results.
And you knew that's where I was going to go next, is long-term care facilities. Because I was a little worried about this upcoming school year, because the way my thinking went was that long-term care facilities, nursing homes, are doing everything they can to protect their residents there, and still they were having cases. How could that not also happen at schools? Tell me a little bit, because we've seen some spikes at certain nursing homes. Are we still seeing spikes at these homes or others today?
We are still seeing cases. I'm not sure I would call them spikes at this point, but we are definitely seeing positive cases. Again, it's not the residents who are going out and getting it. It's the staff going in and out and bringing it to them. And in nursing homes, a lot of people who work there are younger and are lower wage earners, so they may need a couple of jobs to make ends meet. So, oftentimes those jobs are all higher risk, frontline essential jobs. And so I think that there is just a special burden that people in long-term care facilities must shoulder, that they need to take extra precautions in their personal life, because while they could get sick and be sick for a couple of weeks and move along, the people that they are in charge of taking care of could die.
And we have seen time and again that what you have done to help lessen the spread is to try to go backwards. This person A met person B, C, and D, and it's called contact tracing. In other words, the person that you know has been infected, you try to find out who they know, who they've seen, who they've been in contact with. 2 questions. One is, do you have enough staff to continue doing this? And second off, do you have enough compliance with the people that you are actually basing the contact tracing on?
We are continually hiring contact tracers. We have our 6 full-time infectious disease staff who do contact tracing every day, not only for COVID, but for other infectious diseases that may come into the health department. We have hired, and they are working 13 additional contact tracers, and then we have 17 additional Rock Island County Health Department staff who fill in occasionally and have been trained. As far as compliance, the information that we gather in contact tracing is only as good as the information that is given to us. If people are lying, if people are not answering their phone, if they are avoiding us, contact tracing doesn't work. And we know that how we're going to get on the other side of this pandemic is widespread testing and widespread contact tracing. So the testing has ramped up, probably not to where we were hoping it would be at this point, but tests are available. And so now we need the cooperation of people who have been tested positive to help control the rate of this infection.
And I'm glad you brought up testing, because I wanted to talk about that next, is that there are more possibilities for you to get tested, but some complain that once they get the results back, it's days, if not weeks, after they were first tested. I mean, the availability of testing is important. Are you satisfied with the speed of the results returned to you as well as to the patients?
once we were able to ramp up testing capacity, the labs saw quite a bit of a lag. Now we're seeing at the community-based testing site generally about a 3-day turnaround time. That is sufficient. We would love to see it, you know, a day or even a few hours, because when someone gets tested, they should go into self-isolation because they do not know whether they are positive or not. And it's also important to note that that is a point in time. Someone could be tested and then come back negative, but in the meantime, between their testing and their test result, they could have picked it up and spread it all throughout their contacts.
Let's talk about the flu season that's coming up as well. Now you have the flu season with COVID-19. Two things right off the bat is, how would you be able to distinguish between the two? And is it possible to have both at the same time?
They are different viruses. Someone could have them both at the same time. Someone could get infected with both of them throughout the flu season. And the tricky thing with COVID is that the disease mimics so many other diseases. The symptoms are vague. It's a fever, it's body aches, it's chills, it's a headache. Those also are the symptoms for flu. And so the only way to determine whether someone has COVID or someone has flu is testing.
Well, and let's be honest, you also, I know, are pushing for flu shots this year more than ever for one big reason, not only to protect yourself, but also to almost protect the healthcare system. You don't want to be inundated with both of these virus patients coming into the rooms of emergency rooms or even your basic clinic.
That's absolutely true. You know, since the beginning of this, we've been talking about, you know, flattening the curve to protect the healthcare delivery system. If we have a massive flu outbreak on top of increasing COVID numbers, in addition to all the other things that people need to seek medical attention for, our healthcare system could be overwhelmed quite easily. So it's really important that people get their flu shot this year. And we offer them, or will offer them here at the health department. We will have several clinics that we will enact with social distancing measures and capacity limits. We just want you to get your flu shot, whether that's with us, with your physician, at a local pharmacy. Just please get your flu shot.
We've been talking all about COVID-19. The public health department does so many other things when it comes to the public, whether it's children or women's health. You guys are very active. Are things falling by the wayside because of COVID-19? Are you still actively working on all these, even food inspection, all these programs that you do? It's got to be taxing for a department that has limited resources.
You know, public health is only in the news when something bad happens. But every day we are out there promoting and protecting and preserving the health of Rock Island County residents, and to a larger degree, Quad City-wide residents. So we are still seeing clients in our WIC clinic or offering services through drive-through. We're still doing restaurant inspections because we cannot have a foodborne illness outbreak on top of everything else. So we are working very hard in all of our programs to make sure that people can live as healthy a life as possible. And in fact, our WIC clinic has been transitioning to electronic benefit transfer card, and we go live on Monday. So, in addition to everything else that public health has been doing, we have transitioned to how we are going to feed babies and children and moms in Rock Island County.
And usually this time of year, I'm also asking you about measles and other communicable diseases, and that kids have to be vaccinated for the school year. Are you satisfied that those programs are still continuing as they should?
Our vaccination rates are down, and we're very worried about that. The school exclusion date will remain this year as October 15th. So even if children are not in the classroom, they will be prohibited from attending school if they are not properly vaccinated. Many healthcare providers have taken extraordinary efforts to make sure that children are being vaccinated. They're doing drive-through clinics. They're making sure that kids get the proper vaccinations, because it is about flattening the curve with COVID, but with everything else. We cannot have a measles outbreak or pertussis, and we know that these happen anyway, even with full vaccination. So it's really important that parents get their kids into their clinics and get their vaccinations. And
you're always worried about young adults entering college right now, whether it is hepatitis or an old disease that's made a comeback in the Quad City area, gonorrhea, and the fact that young people aren't getting tested or aren't getting treated for these things that could have devastating impacts for the rest of their lives.
That's right. We are still in outbreak status for gonorrhea, and that's been more than a year now. And the people, there is an effective treatment for it, but they must get tested and they must take the treatment, and they must continue to practice safer sex to prevent further infection, because it could lead to infertility. So maybe a young woman does not want to have children right now, but if she did not get her gonorrhea taken care of, she could possibly not be able to have kids when she's ready to do that.
Are you somewhat worried about the coming months with the flu and COVID-19 coming together? I mean, are you at all optimistic as we head into the fall and into the winter?
I like to believe that humans are basically good. I will say that during this time that notion of mine has been tested a little bit. It hurts my heart to see a lot of the selfish behavior that people are doing, just worrying about their lives and not worrying about the community's lives. So I am worried about the healthcare delivery system being overwhelmed with flu and with COVID and with all of the other health needs that people have.
Rock Island County Health Department Chief Operating Officer Janet Hill. If you're going out and about, please do it safely. And Laura Adams has some great ideas for all of us, our friends and our family out and about.
This is Out and About through September 17th. WQPT is holding a screening of Ken Burns' The Gene on September 17th at 7:30 at the Bluegrass Drive-In. Or get your groove on at Thursday Night Groove, a free concert at Schwiebert Park, Thursdays through October 1st at 7 p.m. Check out an art exhibit about the 74 Bridge at the Smith Studio and Gallery in downtown Geneseo throughout September. River Music Experience presents Hale Reid and Mississippi Journey at Live at 5 September 4th at the RME Courtyard starting at 5. Centennial Park is the location for Quad City Touch Rugby. Teams play a minimum of 7 registered players on the field at one time through October 9th. Sign up your team and play. Grab the family and join the fall fun Saturday, September 12th from 9 to 2 with 60-plus artisans, vendors, live music, and family-friendly activities at Iron and Grain in East Moline. A tribute to the music of Fleetwood Mac fills LeClaire Park as the Quad City Symphony Orchestra brings you the Riverfront Pops on September 12th. On stage, Circa 21 presents the delightful comedy The Savannah Sipping Society opening September 9th. While next door at the Speakeasy, Augustana Theater professor Shelley Cooper presents Ethel and Mary, How I Learned to Sing on September 12th. The Quad City Festival of Praise with Big Daddy Weave takes over LeClaire Park September 5th. Get your tickets online. For more information, visit wqpt.org.
The Quad Cities is all in this together. We take care of one another, because that's who we are. So mask up, wash your hands, stay informed, and continue to support our QC businesses. We rally together while staying apart, so that in time, we can get back to the very best version of the Quad Cities.
Electric Larry is a musician in the cities who says 50s and 60s rock are his greatest influence. He came to the stage of Moline's Black Box Theater before the pandemic swept through the area, and he performed one of his original works for us. Here's Electric Larry with I'm Still Here Hurting.
I'm sitting hurting over you. I'm sitting here hurting over you. I'm sitting here, don't know what to do. I'm sitting here looking at the wall. I'm sitting here looking at the wall. I'm sitting here wondering what went wrong. I'm sitting here wishing you were home. I'm sitting here wishing you were home. I'm sitting here wondering what went wrong. I'm sitting here crying over you. I'm sitting here crying over you. I'm sitting here, don't know what to do. But darling, I know I love you. But darling, I know I love you. But darling, I can't go on without you. I'm sitting here hurting over you. I'm sitting here looking at the wall. I'm sitting here wishing you were home. I'm sitting here crying over you. But darling, I know I love you. But darling, can't go on without you. But darling, I know I love you. But darling, I know I love you.
Electric Larry with I'm Still Here Hurting, performed on the stage of the Black Box Theater in Moline. On the air, on the radio, on the web, and on your mobile device. Thanks for taking some time to join us as we talk about the issues on the cities.
Wheeland Presley Funeral Home and Crematory, a proud supporter of WQPT, has been serving Quad City families since 1889. Now providing live stream capabilities for viewing your loved one's funeral or memorial service at their chapel in Rock Island.